Me and Landon Merkel are doing amyotrophic lateral sclerosis, also known as ALS. So basically, ALS is a disease that affects your motor neurons of the spinal cord, and that causes progressive weakness and atrophy of the muscles. This is also most commonly known as Lou Gehrig's disease, and in Latin, amyotrophic means no muscle nourishment, and that's what happens when your muscle doesn't receive the energy it needs. This disease causes your muscle neurons or your motor neurons to die, and that leads to the muscle not being able to control muscle movement. And because of that, you will not be able to speak, eat, move, and breathe. There are also two types of ALS. We have sporadic, which is the most common one we see in the United States, and then we have familial. And familial is inherited from your family, and you have a high chance of passing off ALS to your children as well. Moving forward to the demographics of ALS, more than 5,000 people are diagnosed with ALS in the United States each year. Most people who develop ALS are between the ages of 40 to 70. ALS is more common in men than in women. ALS is not contagious, so not everyone can get ALS, but anyone can possibly get it. Every 2 out of 100,000 people get ALS. ALS occurs throughout the world regardless of racial, ethnic, or socioeconomic boundaries, and it can affect anyone. Military veterans are approximately twice as likely to develop ALS because of their military rigorous experience. Let's talk about the etiology and pathophysiological consequences of ALS. So for etiology, the cause of ALS is not known. No one knows exactly why people get ALS. But there is some really good research as to why we could possibly get ALS. And the first one is genetic mutation. Various genetic mutations can lead to inherited ALS, and we can also see that when we talk about familial ALS because of the inheritance. We can also possibly believe in chemical imbalance, where people with ALS usually have higher than normal levels of glutamate, and too much glutamate can be toxic to the nerve cell. So that's another hypothesis. And the third one is protein mishandling. Mishandled protein within the nerve cells may lead to destroying the nerve cell, which is also another reason as to why people get ALS. But as for pathophysiological consequences, normally the motor neurons will send signals to the brain to tell your muscles to move. With ALS, your motor neurons start to die, and that impedes any signal transportation. Your condition could get worse quickly or slowly. Nonetheless, you'll eventually lose control over your muscles once you get ALS. Over here we have two pictures. One picture shows a normal nerve cell, and the other is a nerve cell affected by ALS. And in the normal nerve cell picture, we see that the nerve cell in general is functioning properly. The signals are being sent, and the myelin sheath is helping that process happen. And that the muscle is also healthy as well. But with the nerve cell affected by ALS, we can see that the muscle is not functioning properly and that there's no signals running from the nerve cell at all. So let's talk about the signs and symptoms and clinical manifestations of ALS. When you first have the signs of ALS, you will usually see muscle twitching, weakness in the limbs, and slurred speech. But once you fully get ALS, you will have difficulty walking or doing normal activities. You will be tripping and falling a lot. You will also have weakness in your leg, ankles, and feet. Your hand will be weak and clumsy. You will also have slurred speech or trouble swallowing. You will have muscle cramps in your arms, shoulders, and tongue. You will have difficulty holding your head up or keeping good posture, and you'll also have a lot of muscle stiffness. All of these simple symptoms are physical deficiencies. Your mentality will probably stay the same, but physically you can't do much. Because this is a progressive disease, many patients who get ALS will slowly or quickly realize that they are getting ALS, and that takes a toll mentally on the patients as well because they will see the start and the end of ALS throughout their life. If you believe you have ALS, you'll have to go through diagnosis. And for diagnosis criteria, the physician will probably do a physical examination, and they will look for those muscle characteristics that I described in the symptoms page. And once they do that, they will look for signs of degeneration of motor neurons in the spinal cord and brainstem. They will also look for signs of degeneration of upper motor neurons, which are encased in the brain. And after that, ALS is only diagnosed after all other possibilities have been ruled out by field test. And by that, they will do diagnostics. And they will do electromyography, which is a type of test that detects electrical energies in your muscles. If there's no electrical energy in your muscles, that means you probably have ALS. They will also do nerve conduction study, which is a test of how well the nerves send signals to the brain. They will also do blood tests to exclude disorders that mimic ALS, because there are other disorders that can mimic ALS, and a muscle biopsy can be done under anesthesia to make certain of that. They can also do genetic tests performed on a blood sample to confirm the diagnosis and to see if you got ALS from the familial part of ALS. Unfortunately, there is no cure for ALS, but there are drugs and other medications that can help slow the progression of the disease. Some medicines can help control spasticity, which is muscle tightness, and other medications can help control pain, and others can help patients swallow their own saliva. Swallowing is a big issue with ALS, and by having medicine that can help patients swallow saliva, it can help them as well. Choking is also common, so some patients may also need a feeding tube to be placed in their stomach. Physical therapy, rehabilitation, and uses of braces and wheelchairs can also help the muscles work as well as possible. Speech therapy can also work to help those who have speaking difficulties, as well as that's another issue that people have with ALS. So what happens after you get ALS? Most patients die from ALS typically due to respiratory failure. Half of those with ALS live at least 3 years after their diagnosis. The speed of the symptom worsens because it affects breathing, and that becomes life-threatening. A factor that worsens the prognosis that if you develop disease later in life, your old age is vulnerable to the disease. Those who have inherited ALS from familial ALS are only likely to survive 12 months. Most voluntary muscles are paralyzed, so obviously movement is impossible. And the muscles that help move air in and out of the lungs are severely compromised as well. Unfortunately, because of all of this, many patients don't live that long. It takes a toll mentally as well, because many people are not able to do what they could do, and that they can't even move at all. So it plays another role because they're limited to what they can do in life. These are our citations for the information that we put on the slides.